Hi, my name is Daniel Tavakman. I am Head of Integration at RehabStat, and today we are going to be learning about the Therapeutic Alliance, appropriate psychological testing, and recovery milestones. The Therapeutic Alliance is a measure of therapist and client's mutual engagement in the work of therapy, representing an important component for achieving treatment success, regardless of the specific treatment modality employed or the underlying cause. Studies suggest that the patients tend to view the alliance relationship as the same over time, whereas therapists and observers tend to indicate more change over time in their alliance ratings. Because patients tend to view the alliance consistently throughout treatment, they are more likely to view the alliance as positive at termination if their assessment was positive. Therefore, therapists must be effective at establishing positive alliances with their patients early in the therapeutic process. Interacting with empathy and genuineness using developmentally appropriate interventions, providing options of therapeutic modalities, and addressing the specific patient concerns can be very strong, helping the therapeutic alliance. This is especially true for psychiatric patients who miss appointments more than other patients. A study in England reported that 19.1% of psychiatric outpatient appointments were missed, compared with 11.7% of other healthcare outpatient appointments. That's over 60% more missed appointments. It is estimated that 31% of community psychiatric patients drop out over the course of a year. Poor attendance with missed appointments is closely linked with medical non-adherence. I'm mainly drawing on an article called The Therapeutic Alliance, The Fundamental Element of Psychotherapy by Dorothy E. Stubb, medical doctor. I have included a link in the description below. I recommend reading the whole thing, and it's very good and not very long. I also included some communication tips to help enhance the therapeutic engagement. Begin with a patient-centric approach. Inquire as to the patient's hopes, dreams, and concerns about treatment. What outcome is the patient seeking from treatment? Is this something you can provide? It is important for you to be clear and specific about how much you value the therapeutic alliance. Convey that you strive to ensure that the patient is getting his or her needs met and the barriers to alliance can be openly addressed. Set clear goals by co-constructing the treatment plan. Make sure you're using an appropriate psychological instrument for the situation if one is needed. The information that you gather with the test can set the tone for the whole recovery process. Set the expectations that you and your patients will discuss and agree on the therapeutic goals and formulate the treatment plan together. Review the treatment progress regularly with discussions of what is working and what is not. Sometimes a retest can be valuable for making modifications and seeing progress. Be sure your patient knows that you are appreciating honesty and candor about adherence to the treatment plan and that you are in it together. Directly address the potential that the patients may feel skeptical about your diagnoses, medications, and treatments. Being able to talk candidly with your patient about what is working and what isn't is important to the therapeutic alliance. This can be especially tricky with patients suffering from addiction. There is a psychological instrument called the Rehabilitation Wellness Index that is designed to cut to the heart of addiction and co-create recovery milestones with the patient. I will share more about that in the next video. Thank you and have a great day.